Not only should we show love and support for our mothers, we should also emphasize the importance of women's health all year round. Join us for an important discussion on why moms should show a little more love and care for themselves in addition to their families, physically, mentally, and emotionally. Joining us is Dr. Blanda, Buckeye's Medical Director. Thank you for joining us, Doctor.
Thank you for having me.
First, tell us about the importance of women balancing taking care of their own health in addition to their families.
Moms have so many priorities that they have to place in their lifetime, but one of the most important things we say is that they need to place their own health as a priority. So before you put oxygen on everyone else, you need to put oxygen on yourself. And so that means making their health a priority and their well-being a priority as well. And one of the ways they can do that is by getting an annual visit with their primary care doctor. And that is to be done yearly. And then they can also make sure that when they're sick, they go to see the doctor, that they're not the last person who gets care. And so that relationship with the primary care doctor, establishing yourself with someone who you trust and you have a relationship with, is the most important.
Now, the women who are mothers here at the station are super women to me, and finding the time to go see your doctor for that annual checkup is so important. So tell us, what can mothers do to make the most out of that time with their primary care doctor?
So one of the things about the annual visit is you want to be prepared for it and you want to think about it. There are times during your day you think, oh, I should ask the doctor about that. Well, write it down so that you know. The other thing the doctor is going to ask you about, they are going to ask you about your family history. So you may not have details that you remember, or you kind of think, oh, I know that. So maybe you should call your family members, your aunts and uncles, and ask about family diseases. They're going to ask you about your medications, so make sure you have a list of your medications, and that if you're having side effects or issues, that you talk to the doctor about those side effects and issues. It's important when you're there with the doctor that you understand what the doctor is saying. And so sometimes the doctor may say something that, it's like, I don't really understand that. Don't be afraid to ask questions about that. You shouldn't leave the office until you understand what has been said to you. And so sometimes it's easier to bring someone with you. And I know sometimes you don't want to do that, it's personal information. But if you have a friend or a spouse, and many health centers have a health advocate who can actually go in and sit with you during the exam. Some people may need an interpreter. The other thing that people will have now is a case manager, or for women who are pregnant, they offer a healthcare coach, which is called a doula, that can go to you during pregnancy.
And one of the more common parts of having your routine doctor's visits is screening. So tell us about some of those screenings that women need to have.
Screening is so critical for women. There are 2 screens that need to be done during your lifetime, and those are the mammogram. Remember that breast cancer is the second leading cause of death in women. And we know that cancer detected early, breast cancer detected early, can be treatable and be cured. However, if you don't get it early, you may not find it. So, the idea of screening. Mammograms will detect 85% of breast cancers. And of those women who are screened early, the 5-year survival rate is 99%. So mammograms are extremely important. And the other thing is they are felt to save about 33,000 lives a year. The other one is cervical cancer. Not as common as cancer, but it still takes 4,000 lives a year. And so cancer screened again early, those cancers have a 90% survival rate, and it's felt that 1 out of 3 of those cancers can be detected early, and so we want to make an impact on that. And over the years, we have made a significant impact. The rate of cervical cancer over the past 50 years has decreased 75%, so that's a great number.
And speaking of support systems such as your friends or even your care team, tell us how Buckeye Health is helping women.
So Buckeye Health really wants to emphasize the importance of the annual exam. And so we really do stress the importance of having a primary care doctor. And so we have our Find a Provider tool on our website that allows people to get a primary care doctor. And we also encourage people through what we call a My Pay Rewards system. It's an incentive program, and it gives an incentive to our members who will get an incentive if they go to an annual exam. For women, if they do their mammography every year, and that is for women between the ages of 50 and 74, for cervical cancer screening for women between the ages of 21 and 64. And the other one that we do that we always forget is the diabetes. Women who have diabetes really need to know more than just their hemoglobin A1C. They need to be getting eye exams, and they also need to be having their kidney function evaluated. So Buckeye incentivizes our people through those MyPay rewards. The MyPay rewards is a voucher card that you can use for home care products, for nutritious food. You can use it for rent and utilities and childcare. And the other thing I want to mention is that those exams are have no out-of-pocket expense to anyone.
Well, thank you so much for all that you do, Dr. Blanda and Buckeye Health. And for you to learn more information from Buckeye Health, just visit their website on your screen.